Praise the Lord. So I used to, a long time ago, back in I think 2004, 2005, I used to witness to AIDS patients in a AIDS hospice called the Mercy Centre in Klong Tui. It's a slum area. And I want to share a testimony. There was one room where they would put patients that were critically ill, or also separate the patients that had tuberculosis. And in this one bed, there was a woman dying. She was skin and bone, and her name was Samniang. And then in the next bed was a relatively new patient who still looked reasonably healthy. She still had her flesh, her adipose tissue, her muscle tissue on her. She may have only been newly diagnosed with HIV, which is the human immunodeficiency virus, which causes AIDS, which is the acquired immune deficiency syndrome. And so, of course, I would preach, I would witness the gospel to both. And the woman that was skin and bone, that was dying, recovered, because the Bible says that believers, we shall lay hands on the sick and they shall recover. She got better now, so much so that she was discharged from the AIDS hospice, joined with a certain church in Ramkhamhaeng called I think it's Dai Lomprakun under Grace Church, and became a Christian. The woman in the other bed rejected the gospel, did not want anything to do with the witnessing, with our witnessing Jesus Christ to her, and yet her health declined rapidly. She went downhill very fast. I'm a former registered nurse. I'm still a qualified registered nurse, although I'm a preacher now, and I've seen all types of illnesses and sicknesses and diseases. I can tell you that this woman died within maybe 6 to 8 weeks. I can't remember exactly, but I marveled at how rapidly her health declined. And yet, this woman that was skin and bone recovered and got better, while this reasonably healthy looking woman that rejected the gospel died. And that's the testimony right there.